Hello, my dear friends. This is Dr. Vijay Nargada from Hubli, saying a few words and giving a short resume of about 10 minutes to my patients on common endocrinological disorders. In YouTube, endocancers are not touched upon as it is of lesser importance to all patients. To introduce, endocrinology is a complex and fascinating branch of medicine studying hormonal regulation and its physiology. Hormones, they influence nearly every biological process, including metabolism, growth, reproduction, stress response, and hence its importance. This YouTube presentation provides an overview of key endocrine disorders and their common clinical presentation. Hormones. What are hormones? They are the body's chemical messengers. They are glands like pituitary, the thyroid, the adrenal glands, and the sex hormones. They control energy, growth, mood, and more. Why does it matter most? Hormonal imbalances cause issues like diabetes, thyroid disorders, bone disorders, sexual and fertility issues. The picture here shows the various endocrine glands and the hormones which have been listed here. To simplify, all glands are depicted in this picture. There are two figures, the male and the female, and it shows all the endocrine organs, mostly the pineal hypothalamus present in the head structures. Then we have the thyroid, parathyroid, and the thymus in the neck and the upper thorax structures. Then we have the adrenal glands and the pancreas in the mid-abdomen. Then we low down have the genital organs, the ovaries in the female and the testes in the males. Now we go to the common pancreatic disorders. What are they? It has an endocrine aspect where insulin is produced and glucagon is produced, and it helps in the glucose regulation. Then we have its exocrine aspect, which secretes digestive enzymes for digestion. Then what is the disease produced by this pancreatic disorder? They are basically diabetes mellitus, which all of us are familiar with, and there is hyperinsulinemia being produced at times. Then we have the NETs called as the neuroendocrine tumors, and malignancy also can be produced in this pancreas. The figure on the left side shows the pancreas, which is in the center, something like a tail-like, which is yellowish in color. And in between, the spots which you see are basically the alpha cells and the beta cells, and the beta cells are the one which produces insulin. Now, understanding diabetes, all of you do know about it, but just a remark here. What is diabetes? It's a condition where sugar levels in the blood are high. There are two types, type 1 and type 2. In type 1, body doesn't make insulin and needs insulin injections. In type 2 diabetes, body doesn't use available insulin properly. What are the symptoms? Commonly, what we call as the increased thirst, increased urination, and increased fatigue. What are the management tips? In short, eat healthy food daily, stay active daily, and monitor blood sugar levels regularly if you are diabetic. Take medications as advised by a doctor. The picture on the left hand side shows us what we call as the diet for a diabetic, where proteins are consumed, then there is starchy carbohydrates which are reduced in quantity, and on the left hand side we see the major part of it goes to the vegetables and fruits. Some fruits are forbidden, which have got high glucose content, and hence they are to be restricted. Now then, from the diabetes we come to a common endocrine problem called as the thyroid disorder. Here you can see the neck of this gentleman or a woman, I think, has been bloated. You can see that U-shaped structure in the neck region which is very much visible. And this is the thyroid gland which produces T4 and 3 as the two hormones. Now if the T4 is decreased, then we call it as hypothyroidism, which produces fatigue, weight gain, and bradycardia. The treatment lies in giving levothyroxine daily. Then if the hormone is increased, T4 is increased, we call it as hyperthyroidism, which leads to weight loss, tachycardia, heat intolerance. And the treatment for this is multiple. You can start with drugs, or you can start with radioactive iodine, or at times you may require surgery also. Very rarely this thyroid can undergo malignancy, and surgery is the answer along with other modes of treatment. Now here is the image of the thyroid gland which has been shown again here. You can see the two lobes on the sides with the central isthmus being connected in its lower part, and this could be even a simple goiter or it could be a malignant tumor of the thyroid as well. Now this is a situation where thyroid is not produced adequately, and this goes in a picture what we have called just now seen as hypothyroidism, and its extreme stage is called as myxedema. This is a picture which shows myxedema. You can see the dry, thick skin, and you can see the lustreless face in this gentleman. Now, after the thyroid, we come to a common problem which you see called as the osteoporosis. What is it? Here, bones become weak and break easily as age advances. That is what is called as osteoporosis. Osteo is bone, porosis is weakening. Who are at risk now? Especially the older adults, male and female, both are at risk. More so women after the menopause. How to prevent it now? Of course, we have to take regularly calcium and vitamin D rich foods like milk, leafy greens and vegetables, and egg at times. Do weight bearing exercise like walking or dancing are also going to be helpful. Avoid smoking and limit alcohol. And the visuals on the left hand side shows a normal bone and an osteoporotic bone. The normal bone is very thick and plenty, whereas the osteoporotic bone, you can see those windows there and the thinned out bone, and that is why they crackle and they break and produce fractures. Lower down also we can see the bones here. There is the femur, we can see the head of the femur, neck of the femur, and the upper shaft also. The left hand side is a normal healthy bone, whereas on the right hand side you can see those lacunae here and the sparsely distributed bony structures there. That is why the bones crack down and break and produce fractures in old age because of osteoporosis. Then next we come to the another important aspect which you see commonly is what is called the polycystic ovarian syndrome. It's called as the PCOS. What is it now? It indicates women's hormonal health, a hormonal imbalance affecting ovaries, where ovaries have a lot of cysts. Normally there are some cysts, but in this case the multiple cysts. I will show you the figure in the next slide. Symptoms. What are the symptoms now? The people have irregular periods, they have acne, and then acne has small pustules which develop on the face, and excess hair growth, especially in unusual areas. Now there is a difficulty in losing weight. It means that they become obese and they are more prone to develop diabetes in due course. Now this is a picture of this PCOS. Upper one is the uterus, and you can see the two fallopian tubes and the ovaries. And the lower down you see the normal ovary, and the ovary has got only a few cysts. Whereas on the right hand side you see the polycystic ovary which has multiple cysts there, and this is called as the polycystic ovary. And especially you can see in young girls when they start menstruating and the periods become irregular, then we do a scan and see that this is there. Now how to treat them? Treatment is a bit simple to begin with. At least the initial steps like lifestyle adjustments that include a nutritious diet, regular exercise and good habits. There is alternative medicine which I will not deal with. Then we have the pharmaceutical options like hormonal treatments at times, anti-androgen therapies at times, and anti-diabetic drugs if the patient is going to develop diabetes, or it can be used in some cases to begin with also, because it is said to be useful for PCOS, especially what we call as the metformin. Now then we come to hirsutism, which is commonly seen in these patients with PCOS or in those with genital disorders. There is females where androgen is produced in excess. Now this picture shows us a lady, for that matter, where extra and excess hair growth is seen in the beard area in a female. You can see those beautiful lines, hair coming up from the sides of in front of the ears as well as in the upper neck area. This is something like a beard which you see in a male, which is now seen in a female, called hirsutism, which is seen in special cases of endocrine disorders. Very rarely, of course, we do not see this so commonly, but this is called as neuroendocrine tumors, NETs. They could be seen in, they produce what is called as the carcinoid tumor, which secretes serotonin. They could be an insulinoma where excess insulin is produced. There it could be a gastrinoma where gastrin is produced from the antrum of the stomach. Then it could be a VIPoma where it secretes vasoactive intestinal polypeptide from the intestines. Now since these hormones are different, each disease presents with distinct hormonal symptoms. On the left-hand side, the image shows the sites of origin of the different neuroendocrine tumors. Now, what are the warning signs of hormone problems? When we suspect that the patient has got a hormonal problem, we watch for different symptoms. If the patient has a constant fatigue or mood swings, then the patient has weight changes without any reason, then there are frequent fractures or irregular periods. Then how to prevent them now? Regular blood sugar tests for diabetes is a must, thyroid test for symptoms like fatigue or weight issues, and finally bone density, especially if the patient is in a menopausal stage or perimenopausal stage. Now, how to stay healthy? This is a beautiful diagram which gives us simple steps to balance hormones. Stay active, 30 minutes of walking or exercise daily, or that is 150 minutes in a week's time. If you are doing it 1 hour a day, do it at least 3 times a week on alternate days. Then eat smartly, include whole grains, then lean proteins and vegetables in plenty. Get enough sleep, 7 to 8 hours per day at least. Take medication as prescribed by a doctor, then see your doctor regularly and get your checkup done. Now the visual on the left side shows how the family should be laughing and doing all the good things. This is an exercise program of the family in toto, and I think they are going for a good meal subsequent to the exercise. Now this is the take-home message and the key points to remember, friends. Hormones affect every part of our body and our health. Common endocrine problems like diabetes, thyroid issues and osteoporosis can be managed very well. Early diagnosis and treatment makes a big difference for the patient and for the doctor as well. Now, if there are any questions, we are ready, and this is the contact address. The Gmail has been given here, and thank you for your time and attention. Thank you, my friends, my patients. Wish you a happy day.